CAR T cells are obviously very exciting, not just within the hematologic malignancies, where there are already 6 different CAR T cells approved in the US, but across a range of solid tumor indications where there's rapid progress through clinical trials. However, ultimately a cancer drug is only as effective for an individual who can actually access that cancer drug. And so it's hugely important, both to me and I think to our field, to try and improve the access for patients to these transformative therapies. One of the biggest barriers to this is their huge cost, and the list price for all of the CAR T therapies currently available in the US is more than $400,000. And in addition to that, hospitals then charge insurers a bundle, and so the total cost for the insurer can be $1 million or more for one CAR T cell therapy infusion. And so we, in our session, will talk all about what the components of that cost are and how we might address the different components of that cost. And so the first component is the actual manufacturing costs, because compared to like a small molecule like imatinib or ibrutinib, which might be quite cheap to make, CAR T cells, because they're a product that is made specific to the individual, they're patient specific. That means that you need a lot of skilled labor, equipment, and logistical processes that cost a lot more to make the actual product than a regular drug. And so that cost, we think, is somewhere between the $20,000 to $30,000 range. And I say we think because a lot of this information is kept very confidential, very deliberately by numerous actors in the space. But so one aspect, or the first aspect, is to try and reduce that manufacturing cost. And some ways that might happen in the coming years might be through things like allogeneic products, CAR natural killer cells, new approaches to manufacturing that automate the manufacturing process. And in fact, we've seen already at this meeting some presentations on novel manufacturing processes, like Novartis has one called T-Charge. There was just one in the CAR T session from China, where they can bring the manufacturing right down to 1 or 2 days, and that also will reduce the manufacturing cost. The next element of the cost that makes up CAR T cells is the price that the manufacturer charges, typically the hospital, but charges whoever's buying the CAR T cells. And as I said, they're typically around $400,000, but some of them are quite a bit more than that. And really the key factor that would shift that in the US is if we included CAR T cell products in price negotiation. So you may or may not know that since last year there was legislation passed for the first time to allow price negotiation for drugs in the US. And it's not yet clear when it comes time for the CAR T cell therapies to be negotiated, whether they'll be included in the drugs that are able to be negotiated. And so really the key thing to bring that next bit of price down would be to try and ensure that they are able to be negotiated, and that they're able to be negotiated earlier. And that would involve amending the Inflation Reduction Act. And then the third element is that total cost of care that's charged by the hospital to the insurer, as I said, can be upwards of $1 million. And the things that might help to bring that cost down would be things like increasing the use of outpatient CAR T cell therapy, trying to reduce and better predict toxicity to prevent intensive care admissions, and other strategies to try and reduce the total amount that CAR T cell therapy costs. So it's a lot to say, but these costs are huge, and obviously are not just a barrier within the US, but they're a barrier to making these therapies available globally. And really what we want to see is that more patients with cancer where CAR T therapy works brilliantly can access the CAR T cell therapy.